This is our 11th lesson, and the topic is conduction pathway disorders or defects. Now, conductive system we know includes SA node and AV node. SA node and AV node are right atrial structure. They are present inside the right atrium. One at the top, another near the septum and lower part, near the mouth of the coronary sinus. The AV node is situated. Upper, at the root of superior vena cava, SA node is situated. We know SA node initiates the impulse. It is a powerhouse of the heart, in short you can say. So, SA node is connected to AV node by 3 internodal branches, which we have already discussed. Then from AV node, bundle of hairs arise, and then it divides into right branch and left branch. Left branch has got 2 divisions, anterior and posterior division. Then each one divides and redivides into a smaller, thin, very thin structure which is known as Purkinje fiber, which merges with the ventricular muscle. So now we know this is the conductive system. If there is any defect anywhere, it can lead to a very minor to a very serious heart conditions. So today we are going to discuss about the defects or in the pathway, conductive pathway. First of all, let us start with the sinoatrial node. Sinoatrial node can be blocked. The SA node we know it is supplied in majority of the cases by right circumflex coronary artery. Supplies the SA node. Similarly, AV node is supplied by a branch coming from the posterior interventricular or posterior descending artery. It is a branch which supplies nodal branch to the AV node. Now, this SA node can be defective because of many conditions, because of the lack of blood supply, because of the old age, gradual degeneration takes place in the SA node. So, a block in the SA node is known as SA block. In SA block, there is an interference with the propagation of an impulse, initiation and propagation of impulse from SA node downward in the lower part of the heart. So, SA node defect then has got 3 degrees. First degree SA block, second degree SA block, third degree SA block. The first degree SA block is impossible to diagnose from EKG. It can only be found by doing electrophysiological study. Then comes the second degree heart block, SA block. Now there is a word which you will listen very often, that is heart block. When we talk of heart block without any qualification, that means AV block, atrioventricular block. But here we are discussing SA node block. So the second degree of the SA block results in dropping of full 1 beat. Entire beat is dropped. No P wave, no QRS wave. And then again it starts back. So this is known as second degree block or sinus arrest. Now, if you see in this diagram, here, first diagram there, written sinus block second degree, you will see that there are normal PQRST 1, 2 and 3 and 4. But fifth, there is no P wave, there is no QRS, and the fifth beat is dropped out. That is no P wave, no QRS, whole beat is dropped out. And then again it starts with the P wave. It could be single drop or it could be block at a regular interval, block at a irregular timing. So this is the second degree heart block, and this is sometime it is second degree block is due to failure of impulse formation in the SA node. Failure of impulse formation in the SA node. Now, so this is our second degree SA block. Then there is a complete SA block, that is third degree. Third degree block is sinus arrest or heart stand still and sick sinus syndrome. I will discuss first the arrest, the sinus arrest. As you see in the diagram A, there is one PQRST and there is no wave for some time, and this is known as sinus arrest. Third degree SA block is complete, is also complete heart block, is known as sinus arrest. As for example, there is a prolonged period in this sinus arrest, there is a prolonged period of electrical inactivity, no electrical activity, no PQRS, and there is nothing, followed by a long pause, and then it starts again. Now, this is third degree block. Here we have to pause. A sinus, if there is a complete third degree SA block, does it mean that heart will stop? There is no heartbeat and person will die? No. God has given so many on things on which we can fall back. If there is a SA block and it is third degree complete and heart is not reviving, then AV node takes over the function of pacemaker. SA node is pacemaker, but when SA node is working, AV node is working under SA node. Now when SA node is gone, then the AV node can take over. Sometime AV node also fails, then bundle of his can take over. All these conductive system of the heart has got a property of automaticity. It can give its automatic stimulus. So that means if there is a complete sinus third degree block, SA block, the person will not die. The lower part, that is AV node and other conductive tissue, will take over and the heart starts beating. So there is a long pause that you will see. The other thing which is seen in old age is the sick sinus syndrome. Now, as we age, our degenerative process takes place in SA node, and that is sick sinus syndrome. Sick sinus syndrome is sometime you will find tachycardia, sometime you will find bradycardia. So it is known as tachycardia and bradycardia syndrome. Now, you see first arrow, it shows tachycardia, and the same strip now the latter part, it is bradycardia. So it is a tachycardia bradycardia syndrome. Sometime there is only bradycardia, heart is slow only. Sometime you may find associated with it there is a atrial fibrillation. So many permutation and combination you can find in sick syndrome, sick sinus syndrome. Sick sinus syndrome is example of complete heart block, SA block. Now, complete SA block. Now, if you see here tachycardia and bradycardia syndrome, this is generally because of the degeneration of the SA node. And now if you put your if you look at the handwritten thing, complete SA block, ventricle governed by subsidiary, that is AV node and a bundle of A's, and the atomicity will be continued if it is gone. Another important point, that these patients they complain of dizziness, fainting, syncopal attack, and this is one of the causes of a stroke atom attack. A stroke atom attack we see quite often with the AV block, but here also you can see. And important point to remember is that such a patient will ultimately, or sooner the better, artificial pacemaker should be applied in such cases to save life. So these are the conditions which results in SA block. Now next time we will continue this SA block. Now we will discuss about the atrioventricular block, AV block, next time. In this chapter of heart block, we will stay for some time. So please concentrate with me. And this is a good time to find out heart rate in case of tachycardia, bradycardia syndrome, applying how to calculate the heart rate. So please revise as well as when we go ahead on the topic. Thank you very much.